My name is Samuel Mahaffy, and I live in Olympia, Washington. I was diagnosed with very advanced prostate cancer 13 years ago. I was 52 at the time, and it was very shocking and very upsetting to me and very upsetting to my family. And I kicked kind of into high gear with it because I have a reputation for being an optimist. So I thought, I'm going to find some way to get past this. But my first encounters with cancer treatment was not positive because the messages were all negative. The first cancer doctors I visited with told me that I had less than a 14% chance to live more than 2.5 years. And I was 52 at the time and had twins who were 6 years old. So that was very devastating news. And I just decided I wasn't going to accept it without doing some more research and seeing what other options were out there. And in the process of doing that research, I discovered Dr. Chen. When I met Dr. Chen, I was really pleased because he was talking like we were going to get past this cancer. He was talking about, well, we're going to do this for a few months, and that doesn't work, we're going to do this. So he was talking like I was going to stay alive. So I thought, well, that's a good start. I also noticed that he was somebody who really researches things well, and I noticed that he's somebody who doesn't talk down to patients. He really asks what you're looking for. He explains options very well, and he sees himself as being part of the team that's helping you get through cancer rather than the professional who's telling you what to do. I visited some other places and tried a few other things first before I met Dr. Chen. And what I was finding was that there wasn't anybody who was putting out much hope in the case of my cancer. It was a very aggressive cancer. I was young to have a cancer that aggressive. So I did try some other things along the way. I tried brachial therapy. I did several other things. And when I came to Dr. Chen, I was ready to take a different approach to it because I didn't see anything that was working for me. And my PSA was continuing to go up very, very rapidly. So I knew I had to be really proactive in finding something that would work if I wanted to be alive. And I had 6-year-old daughters, twin daughters at the time, and I was bent on seeing them go to college, which they did this year. I'm a researcher by trade, so I like somebody who is intelligent, and I like somebody who looks for new information. And it was clear to me from the beginning that Dr. Chen was that kind of an oncologist. I did hormone treatment for a lot of years, which was one of the few things that there was hope for with my cancer being as advanced as it was. And then I managed that fairly well, and it kept the cancer in check. And then the day came when the hormone treatment failed too. So then we had to go back and look for some other treatments. So Dr. Chen explored several different alternative medications that were emerging at the time that looked promising. I went through 2 or 3 of those. Those failed as well. But what I love about Dr. Chen is he never gives up. So that meant a lot to me. And my cancer indeed became more aggressive, but I lived way past the 2.5 years I was told I had left to live. And that was in 2002 when I was first diagnosed. And then in 2013, I was able to complete my PhD, which was one of my life goals, so I was very grateful for that. At the time that I did the defense of my PhD dissertation in the Netherlands, the cancer had progressed till it was in essentially all of my bones, and I had a very, very high PSA at that point that was rising very, very quickly. Men in my age who expect a PSA of 2.5, and my PSA was nearly 3,000. It was 2,890. I had cancer in almost every bone of my body, and even with that extreme diagnosis and extreme circumstances, Dr. Chen just doubled down and said, okay, what are we going to do next? And so in that process I started metronomic chemotherapy, which I have become a very, very firm believer in. I was able to, with metronomic chemotherapy, get the cancer back under control again, sort of put out the big fire. I was actually able to keep working during the time that I was doing metronomic chemotherapy and was able to manage the side effects. I'm not saying it was easy, but I was able to manage the side effects. And what I love about that approach is that metronomic chemotherapy, in combination with alternative therapies that are designed to help support the body's immune system to fight cancer, is that metronomic chemotherapy works with the natural ability of the body to fight cancer rather than shutting down the immune system. So it was really amazing to me that I was able to keep working, keep functioning, keep being a dad, keep giving presentations, and carry on with my life with what most people would have considered a very, very terminal disease. I think that Dr. Chen and Dr. Jignak's program, I always stumble on that name. I'd rather call him Mark because I never really know how to say his last name. And I've actually worked with him since as long as I've worked with Dr. Chen. And they work really well together as a team. But it's a wholly different field than walking into any of the other cancer treatment centers that I've been to, and I've been to quite a number of them. They don't ever give up on anybody. I mean, I've seen lots of patients come in. I saw last week somebody, the first time I met this woman, she was basically being carried in here by her husband because everybody else had given up on her. But Dr. Chen and his team just doesn't give up on people. They just don't. So I think that's an outstanding difference. I have learned from cancer that you take one day at a time, and you live every day with great appreciation for the day. So that's, to me, is the gift of cancer. I would say to anybody who has been diagnosed with cancer, particularly an advanced cancer, the first thing I would say would be take a deep breath. And then the second thing I would say would be get a second opinion. And then beyond that, I would really say don't give up hope, because there's treatment modalities like the one that Dr. Chen is doing that are very, very promising and emerging. And you know, my own life is a testament to that. When I was first diagnosed with cancer, my twin girls were 6 at the time. I went to a violin concert of one of my twins and thought, I'm not going to be here for her concert next year because I've been told I don't have that long to live. And as I mentioned, now they're home from university, one of them studying in China, and I feel incredibly grateful to be able to have lived a full life and to continue living a full life with advanced cancer. And so I would tell men and women who are facing a diagnosis of cancer is don't give up and don't accept somebody telling you that there's not options, because there really are options available.